caring for a sick family member, giving them a hug, helping them eat, or cleaning up after them. It seems like a simple act of love and kindness. But what if that one moment could expose you to one of the world's deadliest viruses? Ebola has caused some of the most frightening outbreaks in modern history, killing thousands of people and spreading fear across entire countries. But how exactly does Ebola move from one person to another? Can you catch it through the air like the flu? Can mosquitoes spread it? Can you get infected just by being near someone with Ebola? In today's video, we're uncovering the truth about how Ebola spreads from person to person and the facts that could help save lives. Welcome back to AleysHealthCare. In our last video, we explained what Ebola Virus Disease is and why it is considered one of the most dangerous infectious diseases in the world. Today, we're focusing on one important question. How does Ebola spread from person to person? Understanding transmission is critical because knowing how the virus spreads helps people protect themselves and stop outbreaks before they grow. Let's begin. What must happen for Ebola to spread? Unlike diseases such as the common cold or COVID-19, Ebola does not spread easily through casual contact. For Ebola transmission to occur, a person usually needs direct contact with infected bodily fluids. The virus enters the body through broken skin, cuts or wounds, eyes, nose, mouth. This means Ebola cannot simply jump from one person to another without a route into the body. However, once infected fluids enter the body, the virus can begin multiplying rapidly. Body fluids that can spread Ebola. Ebola is found in many body fluids of an infected person. These include blood, vomit, diarrhea, saliva, sweat, urine, breast milk, semen. Among these, blood, vomit, and diarrhea are especially dangerous because they often contain large amounts of the virus. For example, a caregiver helping a sick Ebola patient may accidentally touch infected vomit or blood. If those fluids enter a cut on the caregiver's hand or touch their eyes, nose, or mouth, infection can occur. This is one reason why healthcare workers wear protective equipment during Ebola outbreaks. Direct contact with infected people. The most common way Ebola spreads is through direct physical contact with someone who is sick. Examples include touching an infected person's blood, cleaning bodily fluids, helping them use the bathroom, caring for them at home, handling contaminated clothing or bedding. Family members often face the highest risk because they spend the most time caring for infected relatives. Without proper protection, even simple caregiving tasks can become dangerous. Can Ebola spread through the air? One of the biggest myths about Ebola is that it spreads through the air. The good news is, Ebola is not considered an airborne disease. Unlike diseases such as measles or tuberculosis, Ebola does not normally spread by simply breathing the same air as an infected person. You cannot usually get Ebola by walking past someone, sitting in the same room briefly, being near an infected person without direct contact. This fact is important because it helps prevent unnecessary panic during outbreaks. Can contaminated objects spread Ebola? Yes. Objects contaminated with infected body fluids can spread Ebola. These objects may include needles, medical equipment, clothing, bedding, towels, gloves. For example, if infected blood remains on a needle and another person is accidentally exposed, transmission can occur. This is why hospitals follow strict sterilization and infection control procedures during outbreaks. Why funeral practices can spread Ebola. One of the most challenging aspects of Ebola outbreaks involves traditional burial practices. Even after death, the virus can remain active in the body. During some outbreaks, family members washed, touched, or prepared the body before burial. These acts of respect and love unfortunately created opportunities for transmission. Because of this risk, health authorities often recommend specially trained burial teams that use protective equipment to handle Ebola-related deaths safely. This helps protect families while still honoring cultural traditions. When is an infected person contagious? A person infected with Ebola does not usually spread the virus before symptoms appear. Transmission generally begins when symptoms start. These symptoms may include fever, weakness, headache, muscle pain, vomiting, diarrhea. As the illness becomes more severe, the amount of virus in the body increases, making transmission more likely. This means people who are very sick often pose the highest risk to caregivers and healthcare workers. Avoid direct contact with infected bodily fluids. How to prevent person-to-person spread. Stopping Ebola transmission requires several important measures. Avoid direct contact with infected bodily fluids. Wear protective equipment when caring for patients. Wash hands frequently. Properly disinfect contaminated surfaces. Isolate infected individuals. Follow safe burial procedures. Seek medical attention immediately if symptoms develop after exposure. These steps have helped stop many Ebola outbreaks around the world. Conclusion. Ebola spreads through direct contact with infected bodily fluids, contaminated objects, and close contact with people who are sick. It does not usually spread through the air like the flu. Understanding how Ebola spreads is one of the most powerful tools we have for preventing outbreaks and protecting communities. If you found this video helpful, subscribe to AleysHealthCare and turn on notifications. In our next video, we'll explain what are the early warning signs and symptoms of Ebola. Thanks for watching. Like, share, and subscribe to AleysHealthCare for more simple health education videos.